Hello, future doctors. In today's video, we will understand the scapula in a very simple way. By the end of this video, you will master the scapula in the simplest way possible. So, without wasting more time, let's start with introduction of the scapula. The scapula is a flat, triangular bone. It lies on the posterior aspect of the thoracic wall. It extends from the level of the second rib to the seventh rib. It plays a major role in shoulder mobility and stability. It connects the upper limb to the axial skeleton. Now think, does the scapula directly articulate with the vertebral column? No. It is connected to the trunk through muscles. That is why it is called a mobile bone. It articulates with the clavicle at the acromion and the humerus at the glenoid cavity. Thus, it forms acromioclavicular joint and glenohumeral joint. Now, let's discuss about side determination. In practical exam, examiner may hand you a bone and ask you to tell the side. So do not panic and follow this systematic method. Step 1. Identify the glenoid cavity. It must face laterally. Step 2. The spine must be posterior. Step 3. The concave subscapular fossa must face anteriorly. Step 4. The coracoid process must project forward. Now check orientation. If glenoid cavity is on right side, it is the right scapula. That's it. Features of scapula. The scapula has 2 surfaces, 2 borders, 3 angles, and 3 processes. Remember 2-3-3-3 rule. This pattern is easy to remember. Now let's understand each one deeply. Let's start with surfaces. The scapula has 2 surfaces, costal surface and dorsal surface. Costal surface, or anterior surface. The costal surface faces the ribs. It is concave. It has a large depression called the subscapular fossa. This fossa gives origin to subscapularis muscle. Now, understand logically. Since this muscle lies between the scapula and ribs, it helps in stabilizing scapula against the chest wall. Subscapularis is a rotator cuff muscle. Its function is medial rotation of arm. If rotator cuff is injured, shoulder stability is compromised. Dorsal surface, or posterior surface. The dorsal surface is convex. It is divided by a prominent ridge called the spine of scapula. The spine divides the surface into supraspinous fossa, above the spine, and infraspinous fossa, below the spine. Supraspinous fossa gives origin to supraspinatus muscle. Infraspinous fossa gives origin to infraspinatus muscle. These muscles are also part of rotator cuff. So now you know 3 rotator cuff muscles: supraspinatus, infraspinatus, subscapularis. The 4th one, teres minor, attaches to lateral border. Borders of scapula. There are 3 borders: superior, medial, lateral. Superior border. It is the shortest border. It contains suprascapular notch. This notch is converted into a foramen by superior transverse scapular ligament. The suprascapular nerve passes under this ligament. You can remember this by mnemonic: Army overbridge, Navy underbridge. Artery goes over ligament, nerve goes under ligament. Medial border, also called vertebral border. This border gives attachment to muscles that control scapular movements. Attachments include levator scapula, rhomboid minor, rhomboid major, serratus anterior. Now understand clinically, if serratus anterior is paralyzed due to long thoracic nerve injury, the medial border protrudes backward. This condition is called winging of scapula. Lateral border. It is thick and strong. It gives attachment to teres minor, teres major. Also from infraglenoid tubercle arises long head of triceps. Now let's discuss about angles. Scapula has 3 angles: superior angle, inferior angle, lateral angle. The lateral angle is the most important because it contains the glenoid cavity. The glenoid cavity articulates with the head of humerus, forms shoulder joint. Above glenoid cavity is supraglenoid tubercle. Below is infraglenoid tubercle. Attachments: supraglenoid, long head of biceps; infraglenoid, long head of triceps. Processes: 3 processes: spine, acromion, coracoid. Spine divides dorsal surface and provides attachment to trapezius and deltoid. Acromion, extension of spine, articulates with clavicle, forms acromioclavicular joint, important in shoulder injuries. Coracoid projection, hook-like projection. Muscle attachments: short head of biceps, coracobrachialis, pectoralis minor. Ligament attachments: coracoacromial ligament, coracoclavicular ligament. Ossification: the scapula develops from one primary center. Multiple secondary centers appear later. Failure to fuse of acromion leads to os acromially. Clinical anatomy: winging of scapula. Cause: injury to long thoracic nerve. Muscle affected, serratus anterior. When patient pushes against the wall, the scapula protrudes. Rotator cuff injury. Most common muscle involved, supraspinatus. Patient cannot initiate abduction. Fractures. Scapular fractures are rare due to muscle protection, usually associated with high trauma.
If this video helped you, like and share it with your friends. Keep studying smart. You are one step closer to becoming a doctor. See you in next video.